Hello and welcome again to another episode of Matters of the Heart from Haverhill Community Television and Pentucket Medical Cardiology. I'm Dr. Seth Bilazarian, a cardiologist with PMA, and I'm here again with my colleague Dr. Sunny Srivastava to discuss another cardiology topic. And we're here today to discuss the issue of arrhythmia, often felt by patients as a palpitation type symptom. And we want to talk about the history of that and the management of that, and lead off with Dr. Sunny asking you about what it is about. What is it? What are palpitations?
So I thought it would be useful to talk about it because it is one of, if not the most common complaint, certainly one of the most common complaints I get from patients talking about palpitations. And I guess a way to define it is that it is an unpleasant sensation that someone's experiencing of either a forceful beating of the heart or irregular beating or skipping, and ultimately necessitating a mentioning of it to the physician. It's common, it's a very common problem, and there are numerous causes of it that I think we'll ultimately talk about today that run the gamut from very benign, inconsequential things that boil down to being just a little bit of a nuisance for somebody to being very important, significant issues that need attention and treatment and therapy. Palpitations, as I mentioned, are often a sign of arrhythmia or a funny heart rhythm problem. And before I even talk about that, I guess I should briefly just want to mention how the heart beats and what controls it, because we're going to end up talking about aberrations in that normal behavior. So the heart, very interestingly, has an electrical system, if you will, like wires that tell it when to beat. And as many of you know, or many of the viewers may know, that there are upper chambers of the heart called atria and lower chambers of the heart called ventricles. And at the top of these upper chambers, there's a little area of tissue that generates the message telling the heart when to beat. It's called the SA node, or sinus node. And it sends a message down the heart to the middle part of the heart to a place called the AV node, another area of tissue. And then that sends a message down to the lower chambers of the heart. So the heart beats in coordination, the top and the lower chambers of the heart. And normal resting heart or normal heart rate for an individual, we define as between 60 and 100. Some people, or many people I should say, when they need a speeding up of the heart, that node, that sinus node at the top of the heart, can pick up on this from messages from the brain that, okay, you're exercising now, or this is a stressful situation, the heart speeds up. And that's a normal physiologic response to the stress. So I think that, in a very quick nutshell, sums up how the heart beats and the electrical system of the heart.
Okay, so that's the normal situation. Yeah. So let's talk a little bit about arrhythmia. So rhythm is, there's a normal rhythm, and then sort of an abnormal rhythm is arrhythmia. Right. So what is an arrhythmia?
Yeah, so arrhythmia is just that it's an abnormal rhythm, and many people aren't even aware of the arrhythmia. Many people, surprising to many, that they can't feel it or don't even notice it. That's one thing. But two, it is a pattern change or a speed change from the normal heart rhythm. There are a lot of feelings or sensations or symptoms that people will complain of. Many will complain of what we described initially, a forceful beating or a skipped beating, a fluttering sensation. And then there's other symptoms that are a little less obvious but can often be a sign of an arrhythmia or an abnormal rhythm. People can be dizzy, lightheaded, can pass out, can have chest pain, shortness of breath, or just even more vague, can just be weak or lethargic. So it's a little trickier to pick up on that, certainly. So why do these other symptoms exist other than just palpitations? For example, if the heart's beating too fast or too slow and not enough blood is getting to the head, for example, as a result, one can get lightheaded, dizzy, or pass out. If not enough blood is getting to the arteries of the heart, as a result of this, someone can get chest pain. Or if not enough blood is getting to the rest of the body, or the muscles, etc., one could get weak or feel quite lethargic.
Okay. So if a viewer is at home now and is paying attention because they felt like they had palpitations, what are a couple of the things that they should be mindful of in preparation for their visit with their primary care doctor or their cardiologist to discuss this? What are the symptoms or the issues that would help the cardiologist or the primary care doctor sort this out for them?
So, whenever we meet with them, there's a lot of things that we need to talk about, and a very thorough medical history is, of course, important, because there are a lot of other factors that can really trigger or exacerbate heart rhythm problems. So Certainly knowing about one's other medical problems. For example, just a quick example, a thyroid condition sometimes, if it's overactive, can lead to palpitations or fast heart rhythms that are abnormal. So that's certainly useful. If one drinks a lot of alcohol, that can predispose you to certain types of heart rhythm problems, which we'll talk about. Other medications that we commonly prescribe can, for example, slow down the heart, and that's also useful to know too as well. So we're always going to ask questions about the other medical problems, the medications, habits, but certainly getting back to the actual complaint itself, when it's happening, we always focus in on that. Some people have it only with exertion. Some people only notice it. For example, I get commonly said to me that I only notice it at night when I lay down to sleep, and I often think that's just because that's when you're focused on it, that it's there all day, but when you lay down, you're not doing anything else, you're much more aware of it, certainly. But certainly looking for exacerbating factors or alleviating factors are useful. Okay.
So, in one of the things that you mentioned earlier that I would like to just review again, you mentioned the two kind of symptoms. There was a skipping and a racing. Mm-hmm. Is that important, and how should patients be mindful of that for discussion with their doctor?
It's absolutely important. It gives me a clue sometimes as to what might be the problem or might not be the problem. In conjunction with a lot of tests that we'll talk about later in the conversation here, it's a very useful piece of information, certainly. Okay. So yes, so it is a useful thing to focus on.
Okay. So I think that your intention is to tell us a little bit about the different types of heart rhythm disturbances that there are.
Yeah.
So let's go right into that then.
Okay, sure. So there are numerous kinds, and I think an easy way to break them down is that we know that the normal heart rate is between 60 and 100, and so there are those that are fast, greater than 100 beats per minute, and we call those tachyarrhythmias. Tachy means fast, and arrhythmia is just an abnormal rhythm. And the most common...
So tachyarrhythmia, but sometimes we hear people use the term tachycardia. Is that different?
It is a little different, I guess, in a way. Tachyarrhythmia, I guess, implies an abnormal rhythm. Uh-huh. And tachycardia is the phrase that we use just for a fast heart rate.
Okay.
So, what I mean by that is that there can be normal fast heart rates. For example, I think I made mention of it earlier, people exercising, for example. Okay. That's normal. Your heart should speed up. And
so you said a heart rate of 60 to 100 is normal. So if I run up a flight of stairs and my heart rate's 120, am I abnormal?
No, that's a normal response.
Okay.
So absolutely. So and we refer to that as sinus tachycardia.
Okay.
That the sinus node is the normal initiator of heartbeats, and when the heart speeds up, tachy means fast, and cardia refers to the heart rate. So any stress, whether it be physical, like you just mentioned, going up a flight of stairs, or exercise, if people have emotional or stress, that also can do it as well. Uh-huh. Physical illness, if you have a high fever, the heart's pumping faster, or other issues. Pain is another one. If you're very anemic, for example, you've had a lot of blood loss for some reason, the heart speeds up to compensate as well. So these are not necessarily arrhythmias per se. I think they are normal, your body's normal reaction to a stressor. And so they don't necessarily, in general, need specific evaluation or treatment. In some instances, though, I think it can be a sign of underlying heart sickness, certainly, that if, for example, you are sick because you have severe heart valve problems, or if you have something called congestive heart failure and you're in great distress as a result, your heart can certainly speed up as a result of that stress.
Sure. I remember well as an intern being taught that the first treatment for sinus tachycardia is treatment of the underlying cause.
Absolutely.
So we don't treat the heart. It's the heart's just responding to whatever the other thing is. Treat the other thing. Don't focus on the heart.
Oh, yeah, absolutely. All the time. In the hospital, I every day see people who are there with other problems such as a gastrointestinal bleed, and they're very anemic, and of course the heart's going to speed up, and you don't want to slow it down in that situation. That's a compensatory response, so absolutely. So that's a normal response. That's not really an arrhythmia per se. Moving on to other common fast heart rhythm problems, there's one called atrial fibrillation, which has actually been a topic of a prior episode of this show, and it's a ubiquitous problem. It affects millions upon millions of Americans, and what it really is a heart rhythm abnormality originating from the upper chambers of the heart, the atria, hence the name atrial fibrillation, and it refers to multiple rapid, chaotic electrical impulses generated from different spots in the atria, and as a result, the heart rate, or heart rhythm, I should say, becomes irregular, and often can become fast because the lower chambers of the heart are now responding to all these multiple chaotic electrical impulses, and the heart can take off and go fast. So that's another very common one. And people, interestingly, some people never feel it. They could be in this funny heart rhythm with the heart rate going very fast and may never feel it. And many other people are very sensitive to it and feel it quite a bit. So not feeling it does not mean you're not going to have it. There are a lot of treatments, things to discuss here, which may be beyond the scope of what this particular show is about. So I'm not going to get into all the ins and outs of atrial fibrillation, but it's certainly a very important tachyarrhythmia or fast rhythm for us to be to pick up on somebody because there's a lot of.
Well, the only thing that I guess I would ask you, just to get your insights, I'd just be interested to hear what you say about this, is you mentioned earlier that some people don't know, and I certainly agree that some people don't know that they're in that irregular heart rhythm. And we both know and discussed on a prior episode the importance of this problem in terms of other risks, like risk for stroke.
Right, absolutely.
And we're not discussing that either today, but it came to my mind as I thought about thinking about this with you is some physicians, and I haven't done it reliably, but wondered whether you counsel people on how to check their own heart rate by checking their own radial pulse. And is that
and
something?
Some people, certainly there are some people who I may confuse them more than anything, but absolutely there are plenty of people who counsel. And then also a useful way for me to figure out how much these folks are in atrial fibrillation when they're at home in their real life. Sometimes wearing a monitor for a prolonged period of time to see what I refer to as the burden of atrial fibrillation, or how much there is, or if there is any, if someone's asymptomatic from it. So it's a useful. I find it to be a useful test, certainly.
But in terms of the evaluation for the heart rhythm, the pulse is found on the thumb side of the wrist, and most people should be able to feel it right in that area. And we would expect it, if it were normal, to be a very regular heartbeat between 60 and 100 per minute. But if it's this atrial fibrillation problem you described, it's more irregular and faster.
Right. There's no pattern to it. So the normal heart rhythm, there's a very distinct pattern. Boom, 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 boom. It's very straight. And then with atrial fibrillation, it's chaotic all over the place. Certainly.
Great.
So we're talking about fast heart rhythms that people can feel. Along those lines, there's something called atrial flutter. It's like a cousin of atrial fibrillation. Very similar. Perhaps I think just more organized, less chaotic, but also coming from the upper chambers of the heart, can be fast at times. Again, some people never feel it. Many people do. Has the same implications or risks for stroke that one has with atrial fibrillation. And the same conditions that cause atrial fibrillation can cause atrial flutter. And we didn't really talk about that so much, what the causes of these are. Many people, this is just the way they're wired, and this is what happens, and that's that. But there are often other secondary causes. Somebody could have an enlarged heart. Somebody can have severe valvular heart problems that can lead to it. There can be other conditions like an overactive thyroid or alcohol indulgence that can lead to it as well. So there are certainly, or congestive heart failure is another one, certainly other conditions that can lead to these things. Moving on to other fast heart rhythms, maybe I'll jump down to the lower chambers of the heart. We call them ventricular arrhythmias, or there are two very common ones that we talk about, ventricular tachycardia or ventricular fibrillation. And these are pretty important ones because they're often thought of as being life-threatening, certainly. They originate from the lower chambers of the heart, and ventricular tachycardia, as the name implies, just a fast heart rate from the lower chamber of the heart, can often lead to people passing out. And ventricular fibrillation, as the name somewhat implies, is more chaotic or less organized than the ventricular tachycardia. And these often occur in people who have had a history of heart disease. People who have had a prior heart attack or a scar in their heart or an enlarged heart or a weakened heart. Those conditions serve as a spark or a nidus or a trigger for these fatal heart rhythm problems. And people can get small bursts of these heart rhythm problems and feel it. They can feel palpitations, they can feel the heart racing, they can feel a funny sensation in their throat sometimes, or get lightheaded or dizzy or pass out. So they're very important heart rhythm disturbances to pick up upon. They're most commonly associated with other underlying cardiac heart problems, as I mentioned, but there are certainly rare, or I should say less common, familial or genetic conditions that could predispose you to this as well.
So just to say what I think you said, to make sure I understood, the one that you just described, those were called ventricular arrhythmias, ventricular tachycardia, and ventricular fibrillation, I think you mentioned. and those are actually life-threatening.
Yeah.
They can kill you, or they can cause fainting on the sort of the least worrisome being fainting,
Right.
and of course the most worrisome being death. So those need to be treated very seriously.
Yeah.
The other ones, it's not that we don't care about them, but many of the issues with those other problems you described before that are from the upper chambers of the heart cause some problems but aren't life-threatening. Is that a fair way to put that?
I think it's a fair way of putting it. They're not immediately life-threatening by any means. They can certainly be a nuisance and affect one's quality of life because of the symptoms. And then I think probably more importantly is the not insignificant risk of stroke in many people, depending on what other risk factors you may have with those upper chamber heart problems. So that's a very important issue that we see every day, obviously, in the office. I'm trying to think. I think that fairly sums it up for the fast heart rhythm problems.
Okay.
And again, for the majority of these, people feel them, but many people don't. And so it is important for us. In the office, the way we pick up on these things are often just through just simple listening to the heart or EKGs as well. But again, many people don't feel these.
Okay.
So. I think, like I said, I think that wraps up the fast heart rhythm problem. So move on to the other one, the slow.
Right.
And the phrase we use is bradycardia. So brady means slow, cardia again for heart rate. And there are numerous types of slow heart rhythm problems as well. And I think these people, are less likely to feel palpitations necessarily. I think they often feel lightheaded, dizzy, fatigue, sluggish, maybe chest pain or shortness of breath when they try to do things. But not so much palpitations or racing, certainly not racing of the heart or skipping of the heart so much. And some of the most common causes of these things are just simply the aging process. This electrical system that we have in the heart, it ages, it calcifies, it thickens, it doesn't move as fast, I guess is an easy way of describing it. And the heart rate can slow down as a result. And this electrical wiring system that we talked about can develop problems at different points along the way. And we can pick up on what those problems are on the EKG pretty easily, where that problem is going to be. That's not so hard for us to do. There are other things that we often do to people that can exacerbate the problem as well. There are certain medications we commonly use to treat blood pressure, for example. Beta blockers, such as some common names that people may be familiar with, are atenolol, toprol, metoprolol, low pressor, carvedilol is another one. That these medicines are commonly used for a lot of other conditions, such as blood pressure, or coronary artery disease, or congestive heart failure, and they often slow the heart rate down. And so in somebody who's already predisposed to this problem, it can exacerbate it or unmask it and bring it out. Other medications, such as certain types of calcium channel blockers, some of the names